Hello. There's a saying that goes like this. Knowledge is power. Experience, they say, is the best teacher. And whatever you don't know can kill you. Most of us are familiar with that statement, but unfortunately, some of us are not. But how true is that statement? That is the question I'm going to ask you today. When we hear of cancer, we know of someone who's been affected by cancer or have lost families, friends, loved ones to cancer. Today, we are at Gulf Coast Medical Center, and we are going to be talking about cancer to enlighten you all about cancer. There are tales and misunderstandings about breast cancer. Despite years of awareness and research, we still have little knowledge about breast cancer. There are things people need to know about breast cancer that most of us around the world are not aware of, and here they are. Now we have a little knowledge about breast cancer. Now let's go in and talk to Dr. Riggs, a medical degree holder and a surgeon who is very specialized with breast cancer cases.
Well, breast cancer is it's a unfortunately very common disease of ladies. It's a cancer that forms in the breast, and then it can actually spread to other parts of the body.
Okay.
So cancer is an abnormal growth,
Okay.
and the growth is initially in the breast, but then it can spread elsewhere and cause a problem. The first stage is the tumor is less than 2 centimeters in size and has not spread anywhere. Okay. Stage 2 is either over 2 centimeters in size, that's in the breast still, or it's gone to the lymph nodes.
Okay.
So the lymph nodes is where the first place breast cancers go.
Okay.
Stage 3 is when it's a very big tumor and or it's got lots of nodes that are involved. Okay. And stage 4 is actually spread somewhere else, either the lung, the liver, the brain, or anywhere else. So basic treatment first is diagnosis. That's generally done with a biopsy. Typically biopsies are done now just with needle biopsies. And then the primary treatment is surgical. Depending on the stage of the disease, and the biology of the disease, you may require also chemotherapy and or radiation therapy. You know, your diagnosis is usually from either a lady presents with a mass or has an abnormal mammogram. Okay, so the diagnosis is then made on a biopsy. It's usually done here in the office under local. Okay, have the results back within 2 or 3 days. Discuss the diagnosis. Sometimes there are additional X-rays taken, sometimes MRI, but often we just go from the studies that we have and discuss treatment options. Initial surgical treatment option is either lumpectomy, where you just take out the tumor, or the other option is a mastectomy, taking the breast off. In both techniques, both surgeries, we also check the lymph nodes. Okay. Now, the lumpectomy is not the sole treatment to the breast. You also have to have radiation, and that is done later on.
Okay.
The highest distribution in terms of the curve is in the 50s and 60s. However, I mean, I've seen ladies in their 20s with breast cancer, and I've seen it through the 90s. So it does tend to increase with age. There's a spike in the 50s and 60s. But we do see it in younger ladies as well. The information, knowledge is probably the most important thing. If you know what the treatment is going to be, what the stage is, which will affect then the treatment, whether or not you need chemotherapy or not. I mean, that is where family members can be supportive. So supportive in terms of getting patients to the correct treatment, and then if they need additional treatment like chemotherapy, well, people can get sick from that, and so they need family support for that to help get to and from appointments and just help with things at the house. So it's interesting that ladies develop breast cancer and men develop prostate cancer. So if men live long enough to get prostate, ladies, they live long enough to get breast. And it has to do with hormones. The breast is a secondary or sex organ for ladies, and it's responsive to estrogen, progesterone, and that figures prominently in the development of a lot of the cancers. But they also have, ladies have a lot more breast tissue. So breast cancer does occur in men, but it's only 1% of cases, and that's because we just have much less breast tissue. They need to do self-exams once a month. They do it when they're least tender, because their breasts become tender with their menstrual cycle. So when they're least tender, they examine themselves, and they do that monthly. That's so you can check them. They need to check themselves, and then after age 40, they need to get mammograms on an annual basis. You can't really prevent breast cancer, but you can try to catch it early, and therefore it's easily treated. Now, in terms of prevention, there's some things you can do in terms of lifestyle. You can avoid being overweight. You can avoid processed food, and all those things affect cancers in general, and also breast cancer. So there are some things you can do to try to minimize your risk for cancer, but a lot of it is you don't have a lot of control over.
If we want to save lives and end breast cancer, we need to understand its reality on all levels. To anyone out there diagnosed with breast cancer, this is a message from me to you. Stay strong, stay positive, don't give up. My name is Ben Ike, and thank you to my man Chandler behind the cameras. #beat cancer.
Thank you. That's it? That's a wrap?
That's a wrap.
That's a wrap.